अस्सलाम वालेकुम एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। आज हम बात करेंगे एथिकल एंड प्रैक्टिकल इम्पीडिमेंट्स टू कंडक्ट ऑफ रेंडमाइज्ड ट्रायल्स। आज की वीडियो में हम इस चीज़ को काफ़ी डिटेल से आपके साथ डिस्कस करेंगे कि एथिकली एंड प्रैक्टिकली इम्पीडिमेंट्स क्या आ रहे होते हैं रेंडमाइज्ड ट्रायल्स को कंडक्ट करने में। It is often said that some randomized trials cannot be carried out because it is not ethical to conduct them। अक्सर आपने सुना होगा कि ये वाला रेंडमाइज ट्रायल हम जो है नहीं आगे लेकर चल सकते बिकॉज ये हमारे पास एथिकल नहीं है। When it is not ethical to conduct randomized trials of the effects of intervention, क्योंकि तब वो जो है हमारे जो भी हमें रिक्वायर्ड होते रिजल्ट उसके अकॉर्डिंगली एथिकली सेट नहीं होता। The ethics of randomized trials has been discussed intensely for many decades. One point of view is that it is unethical to randomize subject to intervention and control conditions unless the clinician is completely ambivalent about which intervention is better of the two. This is sometimes called as equipoise. A problem with the requirement of the equipoise is that it permits the randomization to be vetoed by the clinician rather than patient. Arguably, decisions about the acceptability of randomization should be made by properly informed patients, not by clinicians. In addition, it has been argued that the requirement of equipoise is impractical. Clinicians rarely express complete ambivalence, inconsistent with many other apparently ethical behaviors and not necessarily in individual patient interest. A more practical and arguably more consistent position is that randomization of properly informed consenting patient could be considered provided there is no clear evidence that one alternative is superior to the other. In our opinion, it becomes unethical to randomize subject to groups only when it is not possible that from an informed patient perspective either alternative could be the best available therapy. There are some situations in which the randomized trials cannot be conducted practically. Some interventions such as the introduction of the management of the strategies are conducted at the level of organization. In theory, it may be possible to randomize parts of an organization to receive reform and other not, but in most circumstances this would be logistically impossible. Other circumstances in which the randomized trials cannot be conducted are when the intervention involves the significant lifestyle modifications, particularly those that must be implemented over long periods of the time or when the outcome of the interest is very rare. For example, it may be impossible to use the randomized trials to determine whether decades of the regular exercise increase longevity because few people would be prepared to exercise regularly or not for decades on the basis of random allocation. Also, it would be prohibitively expensive to monitor large number of the subject over decades when the outcome of the interest is a rare event. It is necessary to study large number of the subjects, so it is often difficult to use the randomized trials to determine the effects of the interventions designed to prevent rare events. At the other extreme, it may be wasteful to perform a randomized trial to investigate the effect of a simple, inexpensive, and harmless intervention that supplements other therapies because there may be little to be gained after knowing of the intervention effect. यहाँ तक